The World Health Organization is drawing global attention to an ongoing outbreak of Ebola in the Democratic Republic of the Congo by declaring it a public health emergency of international concern. This is a rare designation used only for the gravest epidemics and has been applied only 4 times in the past. Now, since last August, the outbreak has killed nearly 2,000 people, more than 2/3 of those infected. So why does Ebola keep coming back to the African continent? Will the international community offer much needed help after the WHO's declaration? And how can we make sure this doesn't happen again? To discuss this and more, I am happy to be joined in the studio by Professor Wang Yudong from the Department of Immunology in the School of Basic Medicine at Peking University. We'll also speak via satellite with Professor Yu Wei, President of the Innovation Platform in Shanghai. We also have Chris Ochamringa, one of our journalists based in Kinshasa. And on the phone, we have Dr. Margaret Harris, Communications Manager and spokesperson for the World Health Organization's Ebola response in the DRC. That is our topic. This is Dialogue. I'm Jonathan Betts.
Ebola is back. Ebola is a rare and deadly disease in people and non-human primates. Its main symptoms are fever, diarrhea, and unexplained hemorrhage. The second largest outbreak was in August in the Democratic Republic of the Congo, infecting 2,500 people. 2/3 of them died. About 12 new cases are being reported every day. Last week, the World Health Organization declared the outbreak a global health emergency. Despite raising the threat level, Johnny Kangason, the director of the African Centers for Disease Control and Prevention, remains optimistic. According to the World Health Organization, a new vaccine has been used for containment. It is 97% effective, and more than 161,000 people have been given it. But everybody is not vaccinated, only those who come into direct contact with an Ebola patient and people who come into contact with them. The response to the latest outbreak has been complicated by sporadic attacks on health workers and conspiracy theories about the current vaccine.
I want to thank all of y'all for being with us today. It's a serious conversation, a serious topic, but I want to start with Professor Wang from Peking University. Help us understand, why does Ebola keep coming back?
I think the reason for Ebola come back is because of the the situation of the West Africa, because this disease is first found in Congo in 1976, and after that there are several times epidemic in Africa, because of the the living habit of the Africa is not very good, and also the economics in this country is quite low level. So many people in the countryside, they are easy to be contained by the Ebola virus.
So Dr. Harris, I'm going to come to you since you're on the ground there. You work with the World Health Organization. Help us understand what the WHO is doing to try to contain the virus.
Okay, we have more than 700 people on the ground at the moment doing all the things that we know work for the public health response. That is finding people who are sick with Ebola, making sure they get to treatment early, making sure that all the people who've been in contact with them are identified, making sure that you vaccinate those people. But you might ask, so why have we still got a huge outbreak? It takes more than simply those things, or if those things were all done completely perfectly, it would stop. But a lot of people don't want to be identified as having Ebola. A lot of people are very frightened of the authorities, and we represent the authorities to them. A lot of people don't tell us that they've been in contact with Ebola. They go somewhere else, go to another town, infect other people. So last week we declared a public health emergency of international concern, because now is the time when we need a lot of international coordination. We need the countries of the world to come together. We need stronger political engagement. We need more resources on the ground to stop this outbreak.
And so, Dr. Harris, is the WHO not getting that? You say you need more international cooperation. Specifically, what?
Well, it has been an outbreak that has not roused a lot of concern and interest in the rest of the world. And there's some reasons for that. The risk to the rest of the world is still low. And I'd like to repeat that. There is no reason for the other countries of the world to panic. However, this has been going on for more than a year. We've got large numbers of people infected. We have managed to keep it within this area with a lot of work and a lot of effort. But the fact that we're still seeing people who don't want to be identified as having Ebola, the fact we are still seeing people who are trying to cross borders, informal borders. We are monitoring all the formal borders, and we are stopping people who've got any signs of infection. We've identified more than 19 cases of people with Ebola trying to cross the border. But because of these things, we are saying to the rest of the world, we're going to have to scale up massively. We're going to have to vaccinate more people. We're going to have to bring in more resources. And that takes an entire world effort to achieve.
Yeah, it's a huge effort without question. So, Chris Okchamringa, our correspondent there on the ground in the DRC, you've been covering this outbreak. You know it intimately. Help us understand how serious is the situation and how has the epidemic evolved over the last few months?
Well, it's very serious. The DRC authorities here are recording about 12 deaths every day. From the start of this outbreak in August last year, they have recorded more than 1,000 deaths so far, and it's increasing by the day. And so the authorities here are very concerned. After the World Health Organization declared this outbreak a public health emergency of international concern, the president of the DRC, Felix Tshisekedi, appointed a new team of health experts who will be coordinating the response because he was not happy with the way things were turning out. So right now there is a man known as Professor Jean-Jacques Muyembe, very experienced in dealing with epidemics like Ebola, Marburg, and he was one of the people who investigated the first Ebola outbreak in 1976. He's the person who's charged with coming up with a new strategy and working closely with the international community to ensure that this outbreak is brought to an end. This outbreak has been a big challenge to the government here because it's happening in a conflict zone. There have been so many attacks on healthcare workers and facilities, and so it has hampered the response that the control of this outbreak, which should have come to an end, but unfortunately it's still raging in North Kivu and Ituri province.
And you know, Chris, you talk about the conflict there, and this is a critical question that I think a lot of people do not understand. Why is it so difficult for health workers to gain the trust of the people there and convince them that they are there to help them fight this horrible disease?
Well, first of all, you know, the people in this outbreak has happened in a remote area. People have all sorts of beliefs, some of them very superstitious, and they don't believe, first of all, that Ebola exists. So many of them don't believe Ebola exists. There was a study that was carried out by a medical journal that said about a quarter of the people in that densely populated area do not believe this outbreak exists. And so people, some of them think that the healthcare workers who have come to help are the ones who are bringing this disease. They're seeing foreigners covered from head to toe in this protective gear that looks like space suits, you know, disinfecting them, and they say, look, you are the people who are spreading this this deadly disease to us. And so the trust has been a big problem. And then there's also another issue of the culture. These people believe that when their loved ones die, they have to be close to them, you know, give them safe, be close to them, touch the dead body, and you know, that really infects more people. When people who have contracted Ebola die, they become very contagious. And so the health workers have been trying to conduct safe burials, you know, keeping people away from these burials, and that is an issue. And so it has become a very big problem. What the authorities here are doing is that they're recruiting locals to carry out the surveillance. and educate people in their own language so that the trust issue can be regained and eventually, you know, the outbreak brought to an end.
So, Chris, I want to pick up on that because that's an interesting point you just mentioned there about bringing in local people using the local language. From your perspective, what do you think needs to be done to build the trust in these communities and to try to contain the spread of this outbreak?
Well, they have to work very closely with opinion leaders, religious leaders, and all the influential people who are respected in North Kivu and Ituri province. Because like I mentioned earlier, these people believe that the health workers, the foreign health workers, have a hidden agenda. Some of them have been saying that these people are trying to sell their vaccines, and that's why they have introduced this disease to our area. And so when they get people who are trusted in the community to champion this cause of, you know, convincing the locals that, you know, this outbreak is real, and if we don't cooperate, if you don't follow instructions that healthcare workers have told you about regularly washing hands, keeping a safe distance from people, not coming into contact with people who have been infected, then you will all die. And that is the message that the World Health Organization, together with the UN and other people, have been trying to pass on, and now it is going to be effected over the next 6 months. They're coming up with a new strategy to try and contain this outbreak.
Chris, thank you so much for that great perspective there. So, Dr. Harris, I'm going to bring it back to you. You're a medical professional there. You work with the World Health Organization. You hear the concerns. You hear the problems there on the ground. How is this affecting your response?
Chris is absolutely right that the key thing is community mistrust. And that is something we find village by village. It's not even simply external people like me who are obviously very much foreigner. It's people who came 2 villages away. The village will say, why are you bringing those people in? These are communities that are very inward-looking. They look to themselves for safety and protection, and they look to themselves for explanations of what's going on. And Chris really identified the issue that people here saw Ebola as something that was brought in from outside. Even if they believe it's real, they're not sure that they believe that what we are saying. Come to the treatment center, identify your symptoms early, make sure that everybody who could be infected has been identified and then seeks vaccination. They are not sure that they really trust us with those things. Now, having said that, over 90% of the people we identify as contacts do get vaccinated and do want to be vaccinated. But with Ebola, it just takes one person who hides their symptoms, who becomes very ill, who vomits on the bus, who stays at home and dies at home and then infects all the other family members. That's how it continues. It's a disease of love. It's a disease of people being together. So it's very difficult to change people's habits and people's attitudes if they start from the position of, we don't trust you.
Right, without question. This is not just a medical campaign, but also an information campaign as they try to control Ebola. We have a lot more to talk about. We're going to continue this conversation, but we're going to take a quick break here on Dialogue. And you're watching Dialogue on CGTN. We're having a very serious conversation about Ebola, so I want to turn to our guest here in the studio, Dr. Wong here. We just heard the concerns about trying to fight this disease. It's not because we don't know how. It's trying to convince people to trust the medical workers. How much does that concern you as you look at this epidemic and look at the concern that this might spread to other countries?
I don't think it will be a very big question because I think the experts think it's not very high risky for this disease will spread to other countries, especially to the developed country. I don't think it's a very high risk.
Well, let's talk about the treatment as well. There is a treatment to Ebola. People have survived Ebola. There's a vaccine as well. How promising is this, and how reasonable or realistic is it for some of these rural communities in Africa?
I think there are at least 3 kinds of vaccines for Ebola. One is from Merck, and it's already used in the DRC, and also it's already vaccinated about about 17,000 people already, and also another vaccine is made by Johnson & Johnson, and it's already clinical trial and vaccinated about 6,000 people, and it's very safe. And also the third vaccine is produced by a China company named Casino Company in Beijing. So I think the vaccine is efficient to prevent the people from Ebola, but the vaccine is not enough for the DRC, because DRC has a population about 80 million people in the country, so the vaccine is not enough. So the efficient way to prevent Ebola is help people to get clean food, clean water, and also good habit in living. So we must give them clean water and food, and also cleaner for their life.
But how difficult is it to change minds in some of these rural communities, and also to get medication doctors in there? You've spent some time working in Asia with the SARS outbreak back in the early 2000s. So give us an idea from your perspective here as a medical professional, just how difficult is it to get into these communities and teach them about sanitation and hygiene and disease prevention and control?
Yeah, but I think we need a good negotiation with the community, because we have an example for SARS. For example, because I did some work in SARS year 2003, and also in the early stage of SARS, and we have also difficulty in negotiation with public. So some of the patients, they don't want to be identified and isolated from others. So we have to test the temperature every day, and to identify the patient who may be suspected.
So, but how do you do that? I mean, what do you do when you have a patient that is not cooperating, that does not want to be identified, does not want to be quarantined, which is another approach that one takes in Ebola? How do you try to convince that patient to cooperate?
Because I think we have several methods to get such outcome. For the first one, the government must give some policy to help the health worker to identify the patient. And the second, we must give some help to the patient with Ebola and their relatives, and also the people who contact with the patient. And also we must issue some books to give them to the community in the country, because I think in Africa country, the education is very important, especially in such a serious time.
Well, Professor Yu in Shanghai, I want to bring you into this conversation too, since I understand you also did some work on the SARS outbreak, in the early 2000s, where hundreds of people were killed there. So what do you think are some of the lessons that can be applied to the Ebola outbreak that you learned from dealing with SARS?
Well, I think the most important action is the central government should take the responsibility to build a disease control system, effective control system to prevent and surveillance, and also quick response to any outbreak. Like China has a large areas, and also has a substantial variation in terms of the economic level and government fiscal capacity. So if the central government does not take responsibility, you cannot build such an effective system. So I think that's very important for other nations to learn. But I understand that for Africa countries such as the DRC and this time the disease outbreak in the remote regions, it seems very difficult to reach the region, and the people is not well educated. So that's really the second question is, I think China also in the past years since SARS increased substantially to public health system, building the drinking, improve the drinking water sanitary systems. I think in the African countries should take same action, but I understand that for those countries they have limited resources. So that's this question to the international society, and what we should do not only to help them control the epidemics, but also help them to build the public health system. Even can be, the help can be extended to even infrastructure, like China has many remote rural areas has been built, the government has built the roads, that improves the transportation and also education system.
I want to follow up on that lessons learned question, Dr. Yu here, because when you look at SARS and what China did and its epidemic prevention control system, what do you think was the biggest change China implemented after SARS?
Well, China has rebuilt its disease control system. If you look at CDC, the website, you can notice that the disease division of infection disease has built a very advanced surveillance system, and that has reached to all the regions, the rural areas, and to quickly get information, any information back to the central system. So that's the system. And the second one, I think China has invested in research. If you look at CDC, they have special centers for communicable disease and for viral disease, for the HIV/AIDS, and for parasitic disease, and also immunization program. That all built the research capacity to deal with any of the future outbreaks, potential epidemics, this kind of emergency systems. So I think those two are very important. And the third one, I noticed that is the public health system. It has been, the community health centers, and also the equipment and the personnel skills should be provided, and the people should be trained. So that's a huge project, but it has been substantially improved since SARS.
Excellent. So some good lessons for the future there. As we heard from Chris's report earlier, the frustration from government leaders about trying to manage this crisis and changing the leadership and health ministers to try to get a control of this. But I want to go back to the ground in the DRC and talk about the current situation with Ebola. So Dr. Harris, right now it seems to be largely confined to the DRC, but there is concerns that it could spread to Rwanda, some neighboring countries there. So how large of a concern is that for you?
That is an ever-present concern. So again, right from the beginning, one of the big areas of work we've been doing with all the partners, with the countries concerned, is preparedness activities. And some of that involves vaccinating health workers, because they are the people who first come in contact with cases in the community, and it's often in the health system, as I've heard the professors discussing. That's where it gets amplified. So we have vaccinated over 4,000 health workers in different countries, in Uganda, also in Rwanda, and also in South Sudan. But we've done more than that. We've worked with those countries to set up Ebola treatment centers, so they're ready, if they get a case, to treat a person immediately, to improve the infection prevention and control. I heard some really important discussion about the importance of improving prevention of spread through better hygiene, clean water, use of teaching different behaviours to prevent the virus from being transmitted. So a lot of that work has gone in the three countries most at risk. That's Uganda, Rwanda, and South Sudan. And as I think you may know, 3 people did cross over to Uganda. They came from DRC, but they crossed over to Uganda, and they all had cases of Ebola. They were identified very, very rapidly once they got to Uganda. They went to a health center. The people immediately recognized what was going on, immediately took all their own actions, and stopped transmission. There have been no cases in Uganda, but no cases of onward transmission. So the only cases we've seen in Uganda have come from people crossing the border, but Uganda managed to stop it. So we can see that preparedness activities really work. Sometimes that's difficult because we need to spend a lot of money on things that you can't see a result of until you've got the problem. But that, again, is why we're alerting the world.
Right, and so Dr. Harris, I'm going to follow up on that there, because you mentioned Uganda, and it kind of made me think about the response, and you seem pleased with Uganda's response. It does seem to be working at this moment here. Do you think that is because government leaders, health ministers, countries are taking this more seriously than they would in the past, considering that awful outbreak in 2014 that killed so many people in Western Africa?
Well, no, I think it's actually because Uganda understands Ebola. They have had a lot of outbreaks, and they are very, very good at dealing with it. Now, the bit of Uganda where the 3 people crossed isn't an area that's got a lot of experience, but as a country, they know what Ebola means, and they know that your best shot at dealing with it is stopping it right at the beginning. The problem in North Kivu and Ituri is that it has never ever been in those areas. And again, that was the problem in West Africa. This was an infection that was new to the areas. The health system didn't recognize it, so it kept on transmitting long before anyone identified it. We now know that the infection had been going on in the community for at least 3 months before the first cases were identified and confirmed. And the outbreak was actually declared on August 1, 2018, but the people had been sick with Ebola for several months before.
All right, Dr. Harris, thanks so much for that. So we're running out of time. I want to turn back to Professor Wong with the last question here. It's kind of an important one. Where do you think we're going from here? Do you think that this could reach the levels that we saw in 2014 with nearly 10,000 people killed?
I think it could be if we do nothing for this epidemic. I think DRC now need help from international society, and I think we will provide what they need. So if we work hard in this area, I think we can prevent Ebola in DRC this time.
We know how to stop it, we know how to contain it, we even know how to cure it in some ways. So a lot of hope that this can get under control. 2,000 people killed already in the past year. That will do it for us here on Dialogue. I want to thank all of our guests here for being with us for this important conversation. I'm Jonathan Bett. That's all the time we have for. Thank you so much for watching Dialogue.